Hello. Welcome to this session of the conference, which I am honored and excited to present to you, Halting the Myths in Their Tracks, Dispelling Cancer Nutrition Myths with Scientific Evidence. My name is Alison Tierney. I am a board-certified oncology dietitian, and I have a pretty intense background in cancer from a professional, but also a personal experience, which I will be happy to share with you here today. So I am so honored to be joining you for this session. However, as you can imagine and probably already tell, I'm not showing up live to this presentation as much as I wish I could join you live. However, unfortunately, my grandmother is in inpatient hospice right now, and I'm doing everything in my power to be able to spend the most amount of time with her in these last days. Because if there's anything that cancer has taught me in this life, it is truly what is most important and what is a priority in this life. And for me, that is family, and that is being by my grandmother's side as much as humanly possible, but also the commitment to this session and helping to really spread the nutrition information when it comes to cancer. This is an incredible passion of mine. It's not only just a passion, it's my profession, but it's also quite personal. So I'm so happy that you are joining today, and let's go ahead and get started. So today we're really going to focus on the nutrition myths within the cancer community with an evidence-based lens. And the reason why I bring many of these topics up is because these are the conversations and the topics that a lot of patients are coming to me with, that I'm constantly trying to dispel this information and really share the information that we know from scientific evidence about how we can contribute nutrition to this field. And in my opinion, nutrition is so underutilized when it comes to cancer, whether it comes to reducing our risk of developing cancer in the first place, helping during the course of treatment, and also especially into survivorship. There are oncology dietitians in cancer centers, not enough, and there's not enough information that is being delved out to patients, especially when they want it. A lot of individuals are coming to me outside of their cancer center because their oncology dietitian may not have given them the depth of knowledge that they were looking for. And that is really where I work with a lot of the clients. They want to go deeper, they want to go further, and what I like to say, they want to leave no stone unturned, right? They want to put everything they have at fighting this disease. And that is where some of my passion lies when it comes to nutrition. So today we're going to examine the myths of sugar feeds cancer and that all sugar should be avoided at all costs. We're also going to focus on soy. The myth that soy contains estrogen and that it should be avoided to reduce cancer risk, especially for estrogen receptor positive breast cancer survivors. Another myth is that cancer cells cannot survive in an alkaline environment. Therefore, consuming an alkaline diet is best for anyone with cancer. And then also the myth that cancer survivors should do everything possible to consume only organic foods as part of a cancer-fighting diet. Now, I'm interested to have some of the reactions and thoughts that you are having as I read these myths to you, but I promise we're going to get into it. I'm going to share the evidence and the information. And my biggest thing when it comes to presenting the information is I believe it's my job to present the information, share what research currently knows. Research is always changing, it's always evolving, and we're going to get to have more and more research as time goes on. But what can we glean from the information here? And the other most important part that I think a lot of people forget is what is realistic, what is something that we can actually do, and what do patients have access to? And I think that part is forgotten, and we'll get to that. And then my other goal is to help make sure that we can explain these common nutrition myths in a way that's easily understood, whether somebody is in the medical community as a medical health professional or somebody that is not. And how do we understand these so that we can apply these to our current day and move forward from there? All right, so just a bit about me. As I mentioned, I'm a registered dietitian. I became a registered dietitian in 2014 and received my master's degree in nutrition and fitness shortly after that. And I did it really quickly, and I actually did some of my master's degree classes while I was doing my undergrad to be a registered dietitian. I had special dispensation from the university to be able to do that, which is why it looks like I completed that undergrad or that graduate degree in 1 year, but it did take a little bit longer than that. It just happened to be that's when I finished the coursework up and my thesis statement. I also became a board certified dietitian in oncology nutrition in 2016. If you are not familiar with this special board certification in oncology nutrition, there are some some select things as a registered dietitian that individuals can become a specialist in, and that requires, every specialty has different requirements, but to become an oncology dietitian, with this board certification, you need to have, I believe it's 2,000 practice hours in oncology before you can sit for a board's exam. And that board's exam needs to be repeated every 5 years in order to stay credentialed. So, which is why you can see that I was first initially certified in 2016 and again in 2021. And I have full plans on continuing this credentialing and taking these board certifications. I've also been a graduate professor and adjunct graduate professor in evidence-based practice in oncology nutrition. And this is something that has been a really great pleasure of mine to do because it is a lot of young up and coming dietitians, and I want to be able to positively influence them and how they look at oncology nutrition, the importance of oncology nutrition, and also making sure that we have a really good understanding about what the science and the data says so that we're giving our patients incredible quality information and ways to help them tackle that in their current situation. Now, that's more of my professional and educational background, but I also have a very personal experience with cancer as well. Now, one of the reasons why I became an oncology dietitian is truly because of the cancer that has burned in my family for generations. And I actually have a previous degree in business and leadership and went back to school to be a dietitian. And I wanted to be a dietitian because of all the people that you see here on the screen. And I wanted to know, how could nutrition help reduce the risk of developing cancer in the first place? How could it help during the course of treatment to make sure that we're tolerating treatment or treatment's more effective, improving quality of life, reducing short-term side effects and long-term side effects of treatment? How can nutrition help? And also into survivorship. What can we do to help reduce our risk of recurrence through diet and also lifestyle? And as you can imagine, I don't think I'd be presenting here in front of you today if we didn't know and find that yes, nutrition can play a crucial role in all three parts of this, whether it be risk reduction during the course of treatment and into survivorship. So here, top of the left screen is my grandfather, who unfortunately passed away from liver cancer. This is my grandmother, who is the one that is unfortunately in inpatient hospice. She's actually a breast and uterine cancer survivor. This is a picture of my maternal grandmother, who passed away before I was born and unfortunately passed away from lung cancer. This is my mom. My mom is a 2-time breast cancer survivor and thyroid cancer survivor. And my godmother, who's my mom's cousin, is also a breast cancer survivor. And if you picked up on it here as well, I myself am also a cancer survivor and experienced breast cancer diagnosis at the age of 33. So to share a little bit about my story is the fact that I was an oncology dietitian before I was diagnosed with cancer. But I also think that my career as an oncology dietitian, the people that came before me in diagnosis, especially young cancer survivors, were really part of helping to identify my breast cancer diagnosis quite early on so that we caught it early, have incredible prognosis, and I'm so thankful for that. But where my breast cancer journey started really truly was here. This is a picture of me nursing my daughter, my second daughter, my youngest daughter, in her last nursing session. And it might seem silly for some people to have a photo of your last nursing session. However, I did this both times for both my kids. And the reason for it is because breastfeeding was a very important part of my motherhood journey. It was also, as you can imagine, as a dietitian, very important to me from a nourishing aspect of being able to nourish my children. And my husband and I unfortunately encountered infertility both times when we were trying to get pregnant with our kids. Spoiler alert, we have 2 beautiful, healthy daughters that we couldn't be more grateful for. However, in this photo here, I can tell you exactly what I was thinking. I was fearful that infertility was going to take this opportunity away from me again. The opportunity to be able to breastfeed another child. And at that moment, I can tell you that I never would have thought that it was going to be cancer that was going to take that opportunity away from me, not infertility. And so about 10 days after this photo right here, I had an annual exam with my OBGYN, breast exam. We found a lump. didn't really do anything about it. And that is because I just finished breastfeeding, and breasts change a lot during breastfeeding. It could be a milk clogged duct, etc. So we didn't really do much about it. But I went home and I always paid attention to it. I kept feeling it. And the only thing that I can truly describe is that every time I touched it, I felt anxious. And I finally reached out to my doctor again a few weeks later and said, I would like to have this further checked out because I'm concerned and I think I need some peace of mind. Immediately, we got an ultrasound. Ultrasound was concerning. Had a mammogram. Mammogram was concerning, and ended up having a biopsy, which 48 hours later confirmed breast cancer diagnosis at the age of 33. Breast cancer and all cancer types are really raising in young adults, and there's a lot of work to be done, and hopefully this can be part of it, and my story can be helpful for early detection, but also reducing our risk of developing the disease in the first place. So after this diagnosis, I opted to have a double mastectomy with something called D-flap reconstruction. D-flap reconstruction is when you utilize your own tissue to recreate the breast. So I do not have implants, but I do have reconstruction. And leading into this surgery, I chose to have a double mastectomy because I also found out that I have a genetic mutation. And as you can imagine, the family history makes a little bit more sense when you find out that you have a genetic mutation, you've been diagnosed at a really young age, and at the same time, a lot of people in your family have been burdened with cancer. But as we know, and I'll continue to share throughout this, genetics isn't the only piece to this. Cancer is multifactorial in its development and its progression. Having a genetic mutation does raise the risk of developing cancer, but it doesn't necessarily mean somebody is going to develop cancer over their lifetime. So I did opt to have this double mastectomy, and unfortunately in the surgical pathology, we actually identified that my diagnosis had changed from DCIS with microinvasion, meaning that it had believed to be contained in the mammary gland and then moved out of the mammary gland just a little bit, to finding out that it was actually invasive ductal carcinoma. And the invasive ductal carcinoma piece was what's called triple positive. And that means that the cancer was positive for estrogen receptors, positive for estrogen receptors, positive for progesterone receptors, and also positive for something called HER2. And so the standard of care here is to have chemotherapy and immunotherapy. So I chose to undergo immunotherapy and chemotherapy. And there's a lot of questions looming now, I think, about chemotherapy and whether people should undergo it. Does it kill more people than it actually kills the cancer? There's a lot out there. And I can tell you my personal opinion, my personal experience is that I wanted to do everything that I possibly could to help reduce the risk of cancer ever coming back. And that was for my kids. That's for my husband. That's who I did this for me, but I also did that for them. But also, as you can imagine, that wasn't the only tool that I used to help me overcome this. And as you'll see, as we continue nutrition, lifestyle medicine, so many different pillars of approach, I think that are incredibly important to help us reduce our risk of developing cancer in the first place, but also help when there is a diagnosis and into survivorship. So I had 3 months of chemotherapy and immunotherapy, the 9 months of immunotherapy. And if you can tell in this photo, I actually have a gray cap on. This is actually a cold cap that I wore during chemotherapy to help save my hair. I had very good success with my chemotherapy cold capping. As you can see, I have a full head of hair. This is all real hair. I estimate that I saved about 85% of my hair during cold capping. However, cold capping is not available to everybody. It isn't an option for everybody. It is financially difficult, and the whole process itself is really hard and sometimes not even successful. So that's something to know about cold capping, but I am thankful that I had access to it and the opportunity to try it and had good success. Now, I continued on and had 9 more months of immunotherapy for a total of 1 year of infusions, and I'm grateful to be able to say that I completed my treatment on August 3rd, 2023, and I got through it really incredibly well. And it's not to say that there wasn't hardships and there weren't hard days and it just, it sucked, right? However, I was told multiple times over and over that I had gone through chemotherapy better than anybody had seen before. And I think this is a testament to my diet, my lifestyle, and all those pillars of health. And that is why I'm so incredibly passionate about being able to bring my knowledge, my expertise, my personal experience to the cancer community. And one thing that I think it's really important to touch on, which will lead into starting to talk about these myths, is because there is so much fear when it comes to a cancer diagnosis. And that fear comes from so many different angles. You know, from my profession and my personal experience, one of those is nutrition. And there is so much information out in the world on the internet about nutrition and cancer, and a lot of it is fear-inducing. And I will not say that I didn't have fear around food ever when it came to my cancer diagnosis. However, what I really want is for nutrition to be empowering. There's so much out of our control when it comes to cancer, but there are some things that are in our control, and nutrition is one of them. And my goal is to help empower cancer patients with knowledge that helps empower them in making choices when it comes to their nutrition, that empowers them, that makes them stronger, that not only impacts their physical health, but their mental, emotional, and their spiritual. Nutrition goes beyond just the actual food in our tummies or the vitamins and minerals and phytonutrients. It can go so much deeper and be so much more empowering than many people believe it can be. So even though I'm going to present the research here today and the information, what I think is commonly missed is the empowerment piece of nutrition. And it's not talked about enough. We need to continue to work nutrition into being a standard part of treatment and protocol when somebody is diagnosed with cancer. And that is the biggest thing that I'm here to educate on today. So what do you say we go ahead and get started? What I'm actually going to do is I'm going to take the video off of myself so that we can concentrate on the science, and then we'll go ahead and get started on that, and I'll come back on the video after this. All right, the first myth that we're going to go ahead and get into today is the myth that sugar feeds cancer, and therefore sugar and carbohydrates should be avoided at all costs. And this myth and this idea that sugar feeds cancer, I will go off and say that, yes, it is true that a cancer cell or cancer itself feeds off of sugar or glucose. But it also feeds off of fatty acids and amino acids, which are from protein. And so it is not the only fuel source for cancer. Cancer is really tricky. Cancer will get its fuel in almost any way possible. So we really need to talk about this myth a little bit more so that we can get a better understanding of how carbohydrates themselves play a role in a cancer fighting diet. So first and foremost, more research is needed to understand the relationship between sugar in the diet and cancer. We do know that, but let's talk about what we do know so far. So the facts are that we have many different types of sugars. There's glucose, fructose, galactose, sucrose, lactose, maltose, etc. And our foods kind of have different combinations of these smaller chain, medium chain sugars that create long chains or complex carbohydrates. So you have everything from simple sugars all the way to complex carbohydrates. But the piece of information that's important to know is that our body is going to break down complex sugars or these long chains into simple sugars like glucose so that our body can use it for energy, okay? What a lot of people forget is that glucose is the primary fuel source for every single cell in our body. Our body wants the glucose. Do cancer cells want glucose too? Yes, they do. Stay with me here. So even though we have different cells that have different jobs, glucose is still the fuel that's going to power every single one of these cells. So the theory is that if we can eliminate sugar and carbohydrates because they turn into glucose, that we would be able to starve a cancer tumor without this. And then the next question is, but what happens without these carbohydrate sources? Let's say someone does decide to remove all carbohydrates from their diet, which means that they're removing simple sugars and complex carbohydrates. That means they're removing broccoli, or they're going to remove a sweet potato, or they're going to remove berries, right, which have carbohydrates in it. What does the body do if it doesn't have the carbohydrate sources? Well, that piece of it is complex. But what a lot of people don't know is that there's a process called gluconeogenesis. This is the process of creating new glucose from non-carbohydrate sources, such as our muscles, such as the fat that we have. So this is another way of me telling you that the body is going to create glucose if it doesn't have it, okay? So what the most important piece here is that it's not necessary, not something that I actually recommend, is to get rid of all carbohydrate-rich foods. Now, am I telling you that we don't necessarily need to avoid sugar, right, from this soda can and how much sugar? There's 40 grams of sugar in a soda or a pop, right? So when it comes back to this sugar and cancer topic, is that we know that cancer cells typically, there's some that don't, but typically grow very quickly, which requires a lot of energy or glucose, right? So the concept again is that if we're having a lot of glucose, a lot of sugar, it's going to continue to feed our cancer cells, and the cancer tumor itself is going to thrive. So if the cancer cells need a lot of glucose, like I mentioned before, then wouldn't cancer cells stop growing if we didn't provide the glucose? Well, it's not that simple. Because if we remove all carbohydrate-rich foods, and thus all glucose, means that we are going to lose out on a wide range of nutrients that are going to support our immune system and complement the fight against cancer. And the reason for that is, think about it, is that these nutrients, our healthy cells, require glucose in order to thrive. We need our healthy cells. We need our immune system to be as strong as possible to help combat against this cancer tumor or cancer cells. So we do not want to remove all carbohydrate-rich foods. In fact, the World Cancer Research Fund and the American Institute of Research shows that these foods that contain complex carbohydrates, such as fruits, vegetables, whole grains, and legumes, they actually have phytochemicals that have demonstrated anti-cancer effects in a cell and rodent studies. And some of these benefits are dietary fiber, carotenoids. The carotenoid is a type of phytochemical, and so many other types. And furthermore, that these compounds found in fruits and vegetables, fruits, because a lot of times individuals are going to get rid of fruits when they're diagnosed with cancer for fear of the sugar. But vegetables and fruit are a very rich source of these nutrients that can help reduce cancer risk. And also there's a substantial body of evidence that shows that these compounds are anti-tumorigenic, right? Help to reduce the ability for a tumor to form in various cell models in both animal and in vitro models, right? So this is where the information is right now. Okay, we don't want to remove complex carbohydrates. Now, am I saying that we shouldn't worry about sugar then? And when I say the word sugar in this context here, am I saying that we don't need to worry about refined sugar, white sugar, etc.? Well, no, I'm not saying that. Research shows that we need to make sure that we're focusing on aiming for whole, unprocessed foods. So that would be the fruits, vegetables, whole grains, and legumes in their most whole food form as much as possible. Because that way we can go ahead and we can get these phytochemicals, the fiber, these things that have shown in studies that we can help be anti-tumorigenic, anti-inflammatory, and so many other great benefits. Unfortunately, research shows that, especially here in the third expert report, recommends with strong and convincing evidence that sugar-sweetened beverages increases the risk of weight gain, overweight, and obesity, which unfortunately increases the risk of 13 different cancer types and is thought to believe that it increases the risk of cancers because of increased inflammation, hormones, and different growth factors. Okay, so what am I saying? I am saying that whole, unprocessed carbohydrates from fruit, vegetables, whole grains, legumes are going to be some of the best cancer-fighting properties that we have. So we don't want to get rid of all carbohydrates. Do we want to try to reduce and even eliminate, if possible, the processed, refined sugars? Yes. Okay, we know that these sugars, they have no health benefit to them, right? If we're looking at this cup of soda here, there's no nutrition value here other than the fact that it provides calories. Okay, and they're pretty empty calories. And what I mean by that, there's no fiber here, there's no protein, there's no fat that is going to help satiate someone, help them feel full. Because if we're getting calories from this, we're never going to be full. We're going to want more and more and more and more, which leads to overweight and obesity. And obviously this topic is a little bit more complex as well, but the bottom line is we really want to focus on making sure that we're getting a diet rich in whole grains, vegetables, fruit, and beans, and trying to make sure that they are a major part of our everyday diet. So the reason why we look at this here is that we know that these whole plant-based foods have those phytochemicals. Phytochemicals are plant-based nutrients that have shown these positive effects, such as reducing inflammation, helping to regulate hormones, preventing DNA damage, and even actually repairing DNA that has already been damaged, and that could happen from just living everyday life. So we want to try to make sure that we're emphasizing these whole unprocessed foods as much as possible. Some people will say, does that mean that I need to be vegan or vegetarian? There is some data to support that a vegan or completely plant-based diet is the most beneficial when it comes to reducing cancer risk. However, there's only some studies that show that. It is not with 100% conclusive evidence to show that. However, we do know that when we predominantly have the diet with whole unprocessed foods and limited meat, processed sugars, etc., that we do have reduced risk of developing cancer. Furthermore, so I put this in here because this is actually a post that I put on my Instagram. When the new year comes in, a lot of people are talking about cutting carbohydrates. And this one says the best way to cut carbs this year is in whatever shape you like them. And really the point behind this is that when we are focused on whole unprocessed carbohydrate foods, they are of great benefit to us. We need to be mindful of how we prepare these carbohydrates, right? This is an example of a potato. I think a potato is very much, and specifically a gold or white potato here, is very much looked at as a non-healthful food. However, potatoes can be incredible. They're high in potassium, they're high in fiber. The problem is that what we usually do to potatoes, that's a problem. We usually deep fry them, probably remove the skin, and not really get the valuable nutrients. So the goal of this post is really to encourage people to focus on complex carbohydrates in their whole unprocessed form and keep carbohydrates in their diet, because that is what is going to fuel their body. Now, keep in mind that there is more to learn, and research continues to investigate. And in fact, this whole idea of sugar feeds cancer, I think that I've seen dietitians or individuals be incredibly extreme about it from one end to the other. From the standpoint of, there are some people out there that say that we need to get rid of the fruits, which hopefully I've shared with you today, that we don't want to get rid of things like fruits because they have really incredible nutrients that are going to support our immune system and overall health. And then there's another end of the spectrum where some people say sugar doesn't feed cancer. It doesn't matter how many Snickers bars you have. In my professional opinion, and where the research lies, is that we're somewhere in the middle there, or maybe even a little bit more closer to one end, but making sure that we're trying to reduce added sugars as much as possible, because research really shows it's actually likely sugar's relationship to higher insulin levels and related growth factors that may influence cancer cell growth the most, not necessarily cancer itself. And so from this point on, this could be a whole nother topic, and I believe there are other presenters in this conference that are going to be talking about insulin resistance. So definitely check those out. But insulin resistance is much more of a bigger culprit here than sugar itself. And there are other culprits of insulin resistance rather than just sugar. Most people believe that it's sugar, but we have to look at the whole picture, the whole diet, and even our fat intake when it comes to insulin resistance. So what is the fact about this? The fact is that the relationship between sugar and cancer is complex. And although research continues to investigate, we really want to make sure that we're incorporating whole grains, vegetables, fruit, and legumes as a major part of the usual daily diet. And that's because the evidence really suggests that these foods can help protect against certain cancers, as well as weight gain, overweight, and obesity, which are risk factors for developing cancer. So the fact is, incorporate whole, unprocessed, complex carbohydrates and aim to reduce or eliminate added sugars from the diet as much as possible. All right, we are moving on to the next myth, which is probably one of my favorite myths to dispel, especially as an estrogen receptor positive breast cancer survivor myself. So this myth is that soy contains estrogens and should be avoided to reduce cancer risk, especially for estrogen receptor positive breast cancer survivors like myself. Now, I believe it's time to set the record straight, but I do think that we're going to be dispelling this myth for a long time coming, and I'm happy to keep sharing the research about how soy is actually very beneficial. So where does this even come from? Like, where did the idea that soy increases cancer risk come from? Well, it primarily came from animal studies rather than human studies. So for example, one of the studies that kind of led to this was that there was a 1984 study of a cheetah they were adding soy meal, and it was believed that it contributed to its inability to reproduce. And then another study, I think this is probably the biggest one where the myth came from, or the idea came from, was a 1998 study showing that the mammary tumors that were existing in mice that had essentially had their ovaries removed and they had estrogen-dependent human breast cancer found that soy stimulated the growth of existing mammary tumors, meaning that when this mouse was fed soy, the mammary tumors or the breast cancer grew. Now, these are studies that, sure, can we learn information from some of these animal studies? Yes. However, the most important thing to know is that we as humans, we are not animals. We are not mice. We can maybe glean some information from it, but we need to take that into account, and we need to have human studies as well. So this whole topic here is that soy is rich in something called isoflavones, which are a phytoestrogen. So a phytoestrogen is really a plant estrogen. So the whole topic of individuals that they should avoid soy is because it contains phytoestrogens, which are believed to increase estrogen in the human body, especially in females. However, it's pretty safe to say that we aren't cheetahs or mice, right? So what do we actually know when it comes to humans and soy? This is where a lot of people don't know this information. The first and foremost is that we have alpha and beta estrogen receptors. So estrogen receptors are essentially, I like to think of receptors as a lock and the actual hormone like the key. So for example, we have a lock, and then which is the receptor, and we have the key, which is estrogen in this case. That only the right key, in this case estrogen, can fit into that receptor. So we have both alpha and beta. So we have two of these different receptors. Now here's where the important distinction comes in, is that in the breast, when the alpha receptor is stimulated, right, or that key is sitting in the receptor, it actually can signal cancer cells to multiply and divide. So this is essentially, think of it as like a pro-estrogen form, right? So the estrogen is sitting in the receptor, in the alpha receptor, and when it sits in the alpha receptor, it can stimulate the growth of these cancer cells. Now, when we have estrogen receptor beta, it actually exerts an anti-estrogen effect, okay? Whereas it is actually essentially lowering estrogen, okay? So if you have the alpha that can stimulate cancer cells, and then the beta that is actually anti-estrogen and essentially can decrease cancer cells' ability to multiply and divide. Now, our natural human estrogen prefers to bind to alpha receptor, okay? Now, soy phytoestrogens prefer to bind to beta. So much, in fact, that it's 1,600% more prefers to estrogen receptor beta, meaning that when we consume soy phytoestrogens, the phytoestrogens are essentially the key in this case, are going to sit in that beta receptor or that lock and exhibit anti-estrogen effects. Okay, anti-estrogen effects. So it actually reduces the effects of the estrogen. Now, in the case that perhaps the estrogen receptor, let me say that again. In the case that the phytoestrogen would sit in the estrogen receptor alpha, okay, even though it preferentially binds to beta, if it does happen to sit in alpha, it actually has 1/10 to 1/100th the signaling capacity of human estrogen, meaning that if it is sitting in this alpha receptor, it is not going to signal cancer cells to multiply and divide the way that human estrogen is going to. Okay, so this is really actually benefit when we consume soy isoflavones. Okay, let's get into the research a little bit more about that. So research has shown that intake during childhood, adolescence, and adult life was associated with reduced breast cancer risk, with the strongest, most consistent effect for childhood intake, meaning that the sooner that we start soy intake, the lower the risk reduction we have as individuals age. You know, I have 2 young girls and they drink soy milk, they eat tofu, and as somebody who has a genetic mutation and may have passed this on to my kiddos, it actually makes me feel really good that they drink soy milk and eat tofu to help reduce their risk of breast cancer later in life. Also, there's a study done on individuals if they're on tamoxifen and also taking soy, found that those eating the most tofu and soy milk products had a 60% reduction in breast cancer recurrence than those who were consuming low amounts. So again, these individuals were taking tamoxifen, which lowers human estrogen, and also consuming soy. Had reduced risk. And research actually shows that consuming just a half of a serving to 1 serving of soy per week reduced all-cause mortality by 21%, a decrease in estrogen receptor negative cancers. And I think what's really important to piece about that is everything is talked about soy when it comes to being an estrogen receptor positive cancer. However, we have some good research to show that when we are estrogen receptor negative, that we have some benefits too, right? So this isn't just for the estrogen receptor positive patients. And then we also saw a 32% reduction for ER positive cancers for individuals that might not be taking anti-estrogen therapy. So whether it wasn't recommended or someone opted not to take tamoxifen or an AI, we're still seeing reduced risk. And that's because of how the soy phytoestrogens operate in the beta receptors, having an anti-estrogen effect. All right. Now, this 2013 meta-analysis shows that soy does not increase breast cancer, but in fact decreases the occurrence, recurrence, and death rates per this meta-analysis. And let's keep going into some more studies. There was a 2021 study that looked at 417 reports of human data. Remember, I talked about how important it is to look at the human data. And the study found that isoflavone intake, the phytonutrients found in soy, does not adversely affect thyroid function, estrogen levels, ovulation in women, or semen levels in men. There's a lot of concern that this might reduce someone's male's testosterone. Not true. The publications also showed no negative effects in children. These results suggest neither isoflavones nor soy food should be classified as an endocrine disruptor associated with the disease and adverse health outcomes. In fact, soy products are actually associated with reduced risk of breast and prostate cancer. And incredibly recent to me providing this presentation, actually published on March 28th of 2024, just 2 weeks ago from my recording here, was another meta-analysis that came out about soy consumption and the risk of cancer. And here we actually see that they included 52 case control and cohort studies that included 861,372 participants from across the globe. And the studies that they looked at actually accounted for very important variables like smoking, alcohol consumption, total calorie intake, BMI, and education. And from this meta-analysis, they found overall that higher soy consumption was associated with a 31% lower risk of cancer, with significant reductions in the risk of gut-related gynecological, prostate, and lung cancers, as well as multiple myeloma. Furthermore, each 100 grams of soy products consumed per day was associated with a 23% risk reduction. It's pretty awesome. And then they kind of looked a little bit further at individual soy products and found that the higher tofu consumption was associated with 28% lower risk compared to low intake of tofu, whereas higher soy milk intake was associated with a 25% lower risk. Now, it is worth noting that the most clear and impressive benefits were seen in the case control studies compared to the cohort studies, which are generally of higher quality. So this is just another meta-analysis that is continuing to show over and over the great benefits of soy when it comes to cancer risk. And really, from my experience, from my research, there is no risk shown by eating soy in any cancer type. So not even just breast cancer or hormonal types, it's actually shown to be risk lowering. Most of the research that we have that shows that soy is not good for us is all done in animal models, which, as we know, the human data matters more. All right, a little bit more here is that isoflavones have been shown to exhibit anti-proliferative, so mean that it makes sure that the cancer cells don't proliferate or divide and grow. Also shows that it's an antioxidant, anti-angiogenesis. Angiogenesis is when a tumor can create its own blood supply, so it's cutting off that blood supply, and anti-inflammatory properties as well. And as I mentioned before, it's reducing, this is incredible for also estrogen receptor negative tumors, not just estrogen receptor positive tumors. Now, some people will ask the question, okay, what kind of soy should I be consuming? Can I eat any kind of soy? It is recommended to be consuming organic, non-GMO soy products. Unfortunately, because the soy products, 90% of the soy products in the US, I believe, are considered GMO, and they have a high amount of pesticides added to them, and I'm going to be talking about that in a little bit when we talk about organic foods here. But research shows that 2 to 3 servings of soy per day is safe, and we want to make sure that we're focusing on the soy that is either in its whole food form or what I like to say is smartly processed. So it does have some processing to it. So that'd be tempeh, miso, tamari, natto, tofu, edamame, roasted soybeans, and soy milk. And I, at this point, would recommend avoiding soy isolate supplements and other soy supplements because we need more data on this, but just like any other type of food too, right? We don't want to consume a highly processed food. We want to try to consume it in more whole food forms. So this is not just related to soy itself to avoid, the isolate supplements and so forth, is that we want to try to avoid highly processed foods across the board. All right, so let's finish up this myth with the fact is that soy does not increase breast cancer, but in fact decreases the occurrence, recurrence, and death rates from breast cancer. And those looking to reduce their risk of developing breast cancer and all other types of cancers actually, and its recurrence should consider regularly incorporating soy foods. All right, let's move on to the next one here. The next myth that we're going to dive in here is the myth that cancer cells cannot survive in an alkaline environment, and therefore consuming an alkaline diet is best for anyone with cancer. Now, the idea and the concept behind this idea is that cancer cells cannot survive in an alkaline environment, and conversely, they thrive in an acidic environment. And this alkaline diet approach is the idea that avoiding acidic foods and consuming alkaline foods can change the pH of our blood. Now, if you go out and you go into Google and you search for an acidic food list, you're going to get a lot of different things. There isn't a very consistent list out there. You're going to most likely be confused because one list is going to say this is alkaline and another list is going to say this is acidic, and there's just really not a lot of consistency out there. Generally speaking, though, if we're going to put this together, we'll find that alkaline foods that fall under that category are going to be fresh fruits and vegetables, plant proteins, and alkaline water. Whereas acidic foods tend to be high sodium foods, processed meats, processed cereals, eggs, caffeinated drinks and alcohol, oats and whole grains, milk, nuts and seeds, beans, and lentils. But like I mentioned before, there just isn't a lot of consistency out there. And just as a reminder, when we think about pH and we think about acidic versus alkaline, we have this scale of 0 to 14. And 7 is considered neutral, so it's neither acidic nor alkaline. And anything less than 7 is considered acidic, and anything greater than 7 is considered alkaline. Now, when I think about the pH, I think about actually the fact we have a swimming pool at home is that, we're testing the pH of our water to make sure that it's safe for our skin and everything like that. However, what we're referring to here is the pH of the human body, and specifically the blood. So when we talk about the pH of the human body, our pH is actually 7.35 to 7.45. It stays in this very tight control between these numbers. And so remember that 7 is considered neutral. So we are slightly, very slightly alkaline here because it's greater than 7, right? Now we have something called an acid-base balance, which is primarily using our lungs and kidneys and sometimes even our bones to help make sure that we're staying in this really tight control of 7.35 to 7.45. The pH of our blood needs to stay in this tight control, and our body's pretty darn good at doing it using our lungs, kidneys, and bones. So for example of how our bones can help us do that is that if there is an issue, our bones can release calcium from the bones, and the calcium that is released from the bones is alkaline, which can neutralize an acid. So as you can imagine, this actually increases the risk of osteoporosis. But primarily it's done through the lungs and the kidneys, and that is to increase or decrease the breathing rate and thus the exchange of oxygen and carbon dioxide to make the pH of the blood either more acidic or more alkaline depending on the state that it's in. And then our kidneys can reabsorb bicarbonate more or less than it needs to in order to help make sure this pH is where it's supposed to be. The important thing to know is that our diet has actually very little influence over the pH of our blood. Okay, I want to emphasize that it has little influence over the pH of our blood. And if it did, we'd actually be in pretty big trouble. Now, it is true that the pH of our saliva and or urine may change slightly based on our diet, but it isn't a true reflection of the pH of your blood. And that is because our blood needs to stay in this tight control. Now here we talk about, I want to go into a little bit about like blood versus urinary chemistry. So this is actually pulled from a study that shows, because I want you to understand the difference between like the blood and the urine and acid load. So research shows that a low carbohydrate, high protein diet increases something called acid load, but it does result in very little changes in the blood chemistry and pH, but can change in result of the urinary chemistry. So we can something can increase in acid load, but doesn't necessarily change our blood chemistry, but can change our urinary chemistry. So this is something important to know as we go into the next few slides. So let's look at nutrition and pH. So when you look at these two foods, we have lemon and orange, and they are citrus. And a lot of people assume that this is an acidic food because they are acidic, right? Especially in terms of how, when it comes to heartburn and so forth, they're acidic. However, what makes something acidic or alkaline actually depends on how our body digests and metabolizes a particular food, not necessarily the fact that tomatoes or lemon and citrus have acid in it. So let's look at some of the studies here. So this particular study looked at animal and plant protein and human bone health and found that if we have increased animal protein in the diet, we have an increase in acid load. But when we have higher amounts of fruits and vegetables, we actually have lower acid load. Now let's focus on what we currently understand before we move on. First, our body must stay in a tight pH control or problems will exist. Our body has several different ways to manage pH, primarily through our lungs, kidneys, and bones. And whether a food is considered acidic or alkaline is dependent on how they're digested and metabolized in the body, not by the food's natural state. And certain foods, such as high amounts of animal protein, can increase acid load in the body, but it doesn't ultimately alter the pH of our blood, as we have tight mechanisms constantly at work to help our pH in a tight range. And as I mentioned in the previous slide here, that higher animal protein diets may create a higher acid load, whereas diets high in vegetables and fruits can actually reduce the acid load. So let's look at a little bit more at the research. Now, the initial studies on the alkaline diet in cancer were derived from studies conducted in a laboratory study rather than in the human body. And there are human studies that are lacking, but we do have a few that we can gather some information on. First and foremost, this one here showed that when we had higher amount of acid load foods, we had increased risk of breast cancer. Also, when we had higher meat consumption, we also had increased risk of breast cancer. And this makes sense together, but we know that higher animal protein increases acid load, which we also know can now increase breast cancer risk. If we have higher fruit and vegetable consumption, we have lower breast cancer risk. And this one also shows that when we have higher acid load foods, such as those higher animal proteins, we increase inflammation and we actually have higher blood sugars. This is something that's not commonly known, is that some of these higher acid load foods are going to increase blood sugars and actually increase our response of insulin and so forth. Now, these two studies that I just shared suggested that higher acid load can increase the risk of breast cancer. So the question here is, in my opinion, is it the alkaline diet itself that is reducing the risk of breast cancer? Well, research actually points that it's more strongly related to the improved health benefits from phytochemicals, fiber, vitamins, and minerals that are present in a high plant-based diet, rather than the fact that these foods may lean towards the alkaline diet. So what am I saying? What am I trying to break this down to? What I'm trying to say is that research has shown that a high consumption of vegetables and fruits with limited meat intake is consistent with evidence-based recommendations from the American Cancer Society to increase our fruits, vegetables, whole grains, and legumes, and reduce our red and processed meats. Eat a diet that's high in whole grains, vegetables, and fruit. Limit the consumption of red and processed meat. We know these things. So, if the interpretation of an alkaline diet is to avoid whole grains, legumes, and fruits, remember when I showed you this chart where, yes, we know that high sodium foods, processed cereals are not good for us, but we're talking about also eliminating nuts and seeds, beans and lentils, and whole grain products. Well, the research doesn't demonstrate that. The research demonstrates that if we're interpreting the alkaline diet to avoid these foods, it's actually not following the recommended eating pattern to help reduce cancer risk. Again, the pattern to reduce cancer risk is a diet that's rich in whole grains, vegetables, fruits, and beans. And research even shows that consuming whole grains, which is also often controversy, is actually strong evidence that it can help protect against colorectal cancer. So what's the bottom line? Truly, honestly, if you're a little bit confused, and it's really because there are important clear inconsistencies between the alkaline diet and what's established when it comes to evidence-based recommendations in nutrition for reducing the risk of cancer and its recurrence. And also, in case you're wondering, there is no evidence to suggest that alkaline water is justified in terms of helping to reduce acid load and alkalinity and achieve alkalinity when it comes to our water. I just mostly tell patients that I think it is very costly to do this and we don't even see any benefit from it. So again, what do we know? We have limited human studies on the alkaline diet in cancer. Studies that we do have show that there is a reduction in cancer risk with an alkaline approach, but likely related to the consumption of fruits and vegetables and limited meat consumption. These components are consistent with evidence-based recommendations for the diet. However, we need more human studies, and in the meantime, the current evidence also reflects that a diet rich in whole grains, vegetables, fruits, and beans is recommended as the nutrition approach to reduce cancer risk and its recurrence, and should be a major part of your usual daily diet. And before I finish this one up, I just want to say I know I saw a post out there on Instagram from a relatively popular physician in the cancer space saying that all cancer patients have a pH of 3 or 4. And when we talk about pH and alkaline versus acidic from that standpoint, I hope you can see that if we had a pH of 3 or 4, we would not be alive. Our body cannot withstand that type of pH in our body. So what we really want to be focusing on is not necessarily whether a food is alkaline or acidic. We really just want to focus on a diet that's rich in whole grains, fruits, vegetables, and legumes, and has limited meat consumption, limited processed foods. We're watching our sodium intake, and so much more. So I hope this helps kind of clarify, make a little bit more clear this really complicated myth that there's just really not much validity and research behind an alkaline approach. There's no reason to restrict these foods, especially the whole grains and beans that are commonly recommended to be avoided in a cancer-fighting diet. All right, moving on to the last and final myth of this presentation is that a cancer survivor should do everything possible to consume only organic foods as part of a cancer-fighting diet. Now, I first want to say that I am not against organic foods. I think that organic foods can be beneficial to reduce pesticide contamination. Doesn't mean that it eliminates pesticides, and it can have some good environmental importance behind it. However, the first recommendation is always to consume as many fruits and vegetables as possible. This recommendation is more important than whether the foods are organic or not. You see, I have a lot of patients that will come to me that say, they have the fear surrounding the organic foods and will just simply not eat some foods or some fruits and vegetables because they can't get them organically. But we know that the benefit of eating fruits and vegetables, regardless of their organic or conventionally grown, outweighs that risk that we're having. And what people often forget about is that there is a large percentage of the population that doesn't have access to organic foods or doesn't have the ability to afford organic foods. So what does the research say? This was a particular study in 2014 that looked at 623,000 UK women followed for 9 years and found that there was little or no decrease in the incidence of cancer with the consumption of organic food, except possibly for non-Hodgkin's lymphoma. Okay, so we're finding in the research that it doesn't necessarily reduce our risk of cancer if we're consuming the organic foods. Now, it's important to note that those who choose organic foods are also more likely to exercise, not smoke, incorporate other healthy lifestyle factors, have higher education, and even more importantly, higher incomes. So they have generally more access and ability to get organic foods, and then also improved access to healthcare. Research went on further. This is a study that was found in a petri dish where there was antioxidant activity against cancer in the petri dish was found to suppress cancer cell growth better than conventionally grown produce. So this is something that we're seeing, which is awesome. However, organic produce tends to be up to 40% more expensive. Now, the scientific literature demonstrates over and over again that a diet focused on whole plant foods and a reduction in alcohol, red meat, processed meat has a greater impact on reducing cancer and chronic disease risk. Where the scientific literature does not clearly conclude buying and consuming organic produce drastically reduces our risk of cancer and improves our overall outcomes. So again, before I summarize this one, I want you to know that eating organic foods, is there a possible benefit? There definitely might be. However, what I don't want individuals to do, remember, this goes a lot back to fear, is that there's going to be somebody who has the fear around these organic foods and chooses to eat, let's say, I'm trying to think of, they're going to choose an organic, refined, white pasta. Not to say that that can't play a role in our diet, but overeating an apple because the apple is conventionally grown. We know the benefit is to still eat the conventionally grown apple. Okay, so again, this is not the fact that organic foods don't provide any benefit in any way. It's more so that we need to be eating our whole unprocessed fruits and vegetables as much as possible to really help reduce our risk. So the fact is that the scientific literature demonstrates over and over again this whole plant-based food approach, and that we should always consume as many fruits and vegetables as possible. And this recommendation in itself is more important than whether these foods are organic or not. And again, if you have access and can afford to have all organic food, awesome. That is incredible. However, again, that is not the case for most people. All right, so this summarizes the myths that we were going to cover today. And so I just kind of want to move on and do some final thoughts here about putting it into practice. Now, we didn't necessarily go into a lot of this, but I do want to emphasize the fact that oncology dietitians can play an incredible role in the success of patient outcomes. And as I mentioned before, nutrition goes beyond just nutrition, right? It goes into the fear and the empowerment and so much that goes beyond this. And so I'm really hopeful that sharing some of this information today really helps empower us to eating a diet that's more focused on whole, unprocessed foods, and particularly those plant foods where we see the greatest benefit. But it's also important to note is that patients need to be counseled based on where they are and also where they are wanting and willing to go, okay? And some individuals, they may encounter a cancer diagnosis and be able to flip their lifestyle 180 degrees overnight. And for others, that is just not as realistic. So it's okay to take small and steady progress moving forward, and also taking into account the resources and tools that are available to a patient. I think sometimes we lose the foresight about what is available to a patient to do. And also our during treatment versus survivorship goals may differ from one another from the standpoint of, let's say someone during the course of treatment is having lots of diarrhea. My goal as an oncology dietitian is to get that diarrhea under control. And sometimes that might mean pausing cruciferous vegetables. Although these cruciferous vegetables are incredibly cancer fighting, we need to help control the diarrhea so that we can tolerate the nutrition and keep the nutrition. And also the standpoint is that cancer changes everything. And as a cancer survivor myself, I know that very, very well, and it changes everything. But if you allow it to be, cancer can be your teacher. And what I mean by that is that it can, for me, it was a big wake-up call. And have I changed some things in my diet since I've been diagnosed with cancer? Yes, I have put different emphasis on different things. However, some of the biggest changes for me have really been some of the other pillars of health that I won't necessarily say that I was avoiding beforehand, but I was not paying as much attention to. And so when it comes to my approach when it comes to cancer, looking at trying to control the controllables. And when I think about this, I know that I have a genetic mutation. I can't change my genes. I can't change the genes that my kids may or may not have inherited from me, but I can control my nutrition. And there are other factors that I can control too. So here we have the 6 pillars of lifestyle medicine according to the American College of Lifestyle Medicine. So many of these things are also within our control. So obviously, as an oncology dietitian, I am emphasizing nutrition. However, there are so many other important factors when it comes to helping to reduce our risk of developing cancer and chronic disease and also healing from it. So we need to pay attention to our physical activity, our stress management. It doesn't mean that we're never going to have stress, but how we manage that stress, how we carry that load definitely makes a difference in our mental health, but also our physical health. Making sure that we're focusing on restorative sleep, social connection. I think that's a powerful piece that is commonly missed when it comes to our health. And then the avoidance of risky substances such as tobacco and excessive alcohol consumption. These are all incredible pillars of health that we can focus on and control and help focus our attention on when we're trying to heal from cancer or help reduce the risk of cancer in the first place. All right, so I'm back on the screen with you here today so that you can see me. I'm finishing this recording from a very different place where I started it. But what I want you to know is that the key takeaway is that research is not 100% conclusive in nutrition cancer. However, what we do know is that it points to more whole, unprocessed foods, particularly fruits, vegetables, whole grains, and legumes. And my hope through this presentation is, especially if you are a cancer survivor, is to help take some of the fear out of these cancer nutrition myths and put the science into it, and therefore put some empowerment into it, and know that to take steps moving forward, depending on where you are in your nutrition and cancer journey, is truly to aim to focus on more whole fruits, vegetables, whole grains, and legumes. I like to think that I've honed that point in pretty darn well at this point when it comes to the number of times that I've said fruits, vegetables, whole grains, and legumes. And my hope is that you will move forward with less fear and have found a little bit more control in this journey. Now, if you want a little extra help in terms of the journey, I have a little freebie for you called Bite-Sized Plant-Powered Strength 10 High-Protein Snacks for Cancer Treatment and into Survivorship. So whether you are aiming to reduce your risk of cancer in the first place, or you're in the middle of cancer treatment, or really trying to embrace this survivorship and looking to add more whole, unprocessed plant foods into your diet, I got this freebie for you. You can grab it at www.wholesomeprograms.com/high-protein-snacks, or you can pull out your phone and use this QR code and it will take you right to that website, and so that you can get this downloadable guide. I got 10 different high protein snacks in there. 5 are ones that you can make from home that have a little bit of a recipe to it, and another 5 are ones that you can purchase to make easier. All right, so as I end this presentation today, I want to thank you for joining me and learning with me. If you want to reach out, say hi, learn more about the programs and clients that I work with, you can find me on Instagram at wholesome.cancer.nutrition. I also have a Facebook page, but to be honest, I am not as consistent on being on Facebook, so you'll best find me on Instagram, or of course at my website, which is www.wholesomellc.com. And thank you for the honor to be able to present this information to you. I hope you find it as empowering as I do. Take care.